turn off your camera, but otherwise we'd like to see your faces. It'll be great. Okay. Good afternoon to all. Are you ready? Yete?
Yes, we are ready. We are already recording.
Thank you. Good afternoon to all, and it's wonderful to see you and your interest in sustainability. I'm just going to quickly mention the United Nations idea about sustainability. The Sustainable Development Goals were adopted by the United Nations in 2015 as a universal call to action to end poverty, protect the planet, and ensure that by 2030, all people enjoy peace and prosperity. There are 17 goals, I'm not going to mention them all, but they recognize that action in one area will affect outcomes in others, and that development must balance social, economic, and environmental sustainability. The Sustainable Development Goals are designed to end poverty, hunger, AIDS, and discrimination against women and girls. And it is my privilege today to introduce you to 3 grantees that we are very proud of, that are actively busy with upholding these goals and working towards a peaceful and prosperous world for all. I'm glad to introduce to you Oluchi Ezekanaga, a 2017 South Africa Program grantee, and she hails from Nigeria. She holds a PhD in nutritional sciences, has more than a decade of experience in the intersection of nutrition, agriculture, and health. Welcome, Oluchi. And then we have Batul Fatima, a 2011 US-Canada Program grantee, and she hails from Pakistan. She holds a PhD in public health and global mental health, serving as an assistant professor in the Department of Community Health Sciences at the Aga Khan University. Welcome, Batul. And then Thandeka Chabalala, a 2017 South Africa Program grantee, and she hails from Eswatini. She holds an MPhil in Development Studies. Her focus is on climate action integration in urban planning processes across African cities. Thandeka, we're very happy that you're here. And then our moderator for tonight, the ever very talented Priscilla Lynn. She's the creator of these MEG talks. It's her ideas that come forward, and we're very grateful for every MEG talk we've had, seeing that they are always successful. Thank you, Priscilla. I think you can take it from here.
Thank you so much, Madeline. Once again, I'd like to welcome our presenters this afternoon. And I'd like to start with a question, rather than asking you to tell us something about yourself. I'd like you to just briefly state what is your interpretation of sustainability? And we could go in alphabetical order. So maybe Oluchi, you'd like to start if you can.
So for me, sustainability is I always think about it in terms of my core discipline. I think about it system. Are we having a sustainable food system, even with the transformation? I think about it in terms of diets. Are our diets sustainable? I mean, in 2010, FAO made an effort to define for us what a sustainable diet would be, about a diet that protects us, that protects our environment, but also a diet that takes into consideration the future of our children and future generations to come. Something else that I think about in terms of sustainability is in terms of the interventions we do. So mitigation is something we do well, adaptation is something we do well, but there is also this consideration, especially in when we look at interventions regarding nutrition, that I want to frame also in the light of sustainability. And that is, how do we ensure that while we're trying to reduce undernutrition, that we do not concurrently increase overnutrition, overweight, and obesity? So these to me are the things I refer to when we talk of sustainability. But at the core front of all these things is one of my beliefs that diversity, it's kind of a bedrock that possibly is missing. Maybe we have it now, but not as much as I would like. And that means looking at all our solutions and making sure that they are diverse. Are our crops diverse? Our planting systems diverse? Our food systems diverse? What actually does diversity mean when it is that the plant has, or that the earth has bestowed to us for our lifetime? So these briefly are my few thoughts and directions regarding sustainability.
Thank you so much. That's very eloquent. Batul, would you like to talk about your perception of sustainability?
Definitely. So, being a public health professional and particularly working more into mental health professional, the way we look at sustainability is more into how the health system can sustain itself. So from sustainable, we look at it as it's something that can sustain itself. So the healthcare system that can sustain itself beyond the project of or program, timeline. So there is economic sustainability besides environmental sustainability, and we also look at social sustainability. So when we talk about mental health, when we look at mental health, so we look at more from the perspective of prevention and also how people can, take care of themselves. So the element of self-help. So not being too much dependent on the health system or the external factors, how we can build their resilience, how we can build their own capacity and coping skills so they can take care of themselves, and building the social fabric so that people can help each other through within their social circle. So it's a sustainable system where people can support their family members, their community members, their social members in their social context. So the mental health and mental well-being of people can sustain by themselves, and further mental illnesses can be prevented so that there is less need of or less dependency on the health systems. And when it comes to health services as well, the health services can also sustain by itself rather than being dependent on donor funding for a long time or any external resources.
Thank you again. Very, very eloquent. And last but not least, Vandeka, could you perhaps tell us your perceptions of sustainability?
Thank you. Yeah, so from my side, because of my work, I also focus on energy and cities. And if you think from a household perspective, I am interested in sustainable energy access, so which speaks to ensuring that households have access to clean energy sources. And that's very important because it affects their health. And because of the indoor pollution that unsustainable energy sources normally produce and causes respiratory diseases for mostly women and children. And then also, in terms of when you look at a household, if they also, just to link to the other speakers, when you think about the fact that when they don't have good sustainable energy sources in their homes, it also affects other aspects of their lives, such as the food that they eat. So if you think from a South African perspective, if a household doesn't have enough money to buy electricity, they would normally then maybe, think of buying much more cheaper food, such as noodles. 2-minute noodles is very popular, and that actually affects the household's nutrition. So it's just like from a sustainable perspective, it's like, does the household have access to clean energy sources, but also can they sustain themselves throughout the month in order for them to be able to access good energy sources? So from an affordability perspective, those energy sources need to be affordable so that they meet the household's needs. And then also, when you think from a city's perspective, because I also work from a settlement perspective. So if a settlement does not have access to electricity, for example, there's quite a lot of challenges that settlement might have check fires because they're using open fires for heating or maybe for cooking, and it affects everyone in the settlement when there's a check fire. And also, if you think about households having access to modern energy such as electricity, they're able to charge their cell phones and they can access other resources that are outside of their settlement, and that enables them as human beings to grow and also participate economically in the city environment. Yeah, thanks.
Thank you. 3 really quite amazing answers, and the 3 answers show how sustainability is interlinked in all our survival. Again, Oluchi, would you be able to tell us something about why sustainability is important for your work, and perhaps even more important, how do you plan for it?
So why it's important for my work, I think it's a given, because where I see it is in an organization that has focused all its efforts in trying to get food, land, and water transformation. So that is our mission. And we cannot get food, land, and water transformation without sustainability. The whole effort of transforming is to transform us from whatever unsustainable practices, unsustainable policies that has led us to where we are, to become sustainable and to be, or at least be on a path of sustainability, both regarding our food systems, our land systems, and our water systems. I think water systems are something that we always miss when we talk about sustainability in some places. But for some other places, the dry lands, the islands, water is a very essential commodities. For even communities that depend on the blue economy, like the oceans, water is very vital. Now, how has my work approached it would be, how has the work of my organization approached it? I think our impact platforms are like the best bet and best description of how we look at sustainability, given also because we work with agriculture and food systems. Our impact platforms best present opportunities to build sustainability, because we have 5, and that is food security, nutrition and health, climate change adaptation and mitigation, environmental health and biodiversity, and poverty and inclusion, and then gender, youth and social inclusion. So how we're looking at it is that any given food system or agriculture that the world has proposed or is proposing or we're looking forward to, it has to be a place or a sort of system that women participate without any gender. How would I frame it now? But that kind of includes women and youth. So that is at the forefront of our efforts. It's also at the forefront because poverty is also at the forefront, because low-income farmers are who we work with mostly. And any given system has to provide income for low-income farmers. It becomes very unsustainable if the people that provide food for us do not have enough to fend for themselves. And then, of course, we go to nutrition. So the core thing about nutrition is that these farmers make this food, and we have to be healthy at least to make this food. I mean, that is a given. So nutrition becomes very fundamental in how we track it. But then at the introduction, I also made mention of diversity. So that is where the environmental health impact platform and the diversity comes in. How exactly are we making sure that we who are trying to provide food do not contribute further to the loss of environmental health? And then there is this key focus on how climate is being adapted for and how we mitigate on everything. So I think looking at these 5 impact platforms or through these lenses are quite vital to ensure that the food system is in a way very wholesome, but also that it becomes sustainable, because just like I mentioned, if any of these 5 things are kind of missing in a food system, it's not going to be sustainable for long. And it's also going to exacerbate whatever situation we're trying to mitigate or fight against.
Thank you. The same question. Why is it important for your work, and how do you plan for sustainability in your programming?
My work, mental health, we see a lot of disparities globally, not just in Asia or Africa. So there are a lot of disparities in addressing mental health and mental health services. And marginalized population, they experience, a lot of barriers to accessing mental health services. And they also have higher rate of mental illnesses. So sustainable practices in mental health, we aim to reduce those disparities by ensuring equitable access to mental health care, ensuring, equitable resources are available and support services are available. And we also try to do this by promoting resilience and well-being within the communities through, preventive measures, early interventions, community-based services. Another thing that we are mindful of is that sustainable mental health practices also recognize the social determinants of mental health. So the mental health, which is part of SDG 3, is very much interlinked and interconnected with other SDGs, such as poverty, education, housing, and employment. If people do not have enough resources to sustain themselves, if they are poor, they have low socioeconomic status, they are lower on economic education side, they don't have proper housing. So these kind of, factors also increases their stress level. So these are very much interconnected. So if we want to work on mental health, we need to really work on the social determinants of mental health as well. And the way we are trying to do is we are trying to integrate mental health into the existing primary healthcare systems to make it sustainable, because a primary health system, as also recommended by WHO, it is the pillar of healthcare system basically, and we are trying to increase the universal healthcare access through primary healthcare services, and within that, if mental health is integrated, it could be accessible for all the communities everywhere. Also, what we are trying to do is to build partnerships and collaboration, increase referral services where it is really needed when there are serious cases, something. Also, we try to mitigate the impact of emergencies and crises. As we know, there are so many emergencies and conflict situations going on, and these further, increases the risk of mental illnesses and trauma. So we try to mitigate it through, providing not only services, but also how, trauma-informed care and community-based systems can be developed, or recommendations in those settings can be provided. Also, what we work on is policy level changes. So we advocate for appropriate policy changes as and where needed. So whether countries have mental health policies in place, if the mental health policies and action plans are implemented appropriately or not, and if there are any changes that are required in mental health policies or action plans to ensure that all the segments of the population, particularly the vulnerable population, the marginalized population, they are not discriminated, and they also have access to mental health services.
Thank
So
you
this
so
is how.
much. And again, Dandika, not last but not least, would you be
Yes.
able to talk to us a little bit about your sense of why it's important for your work and how you plan for it in your work?
Yes. So in South Africa, everyone is talking about the energy transition, which is like a big systematic change of the energy system from a coal-based energy system to a renewable based energy system. And a lot of people are doing a lot of work at the bigger scale, focusing on what is happening at Eskom or even at municipalities, how they're generating energy. But the focus of my work really is to understand how low-income households experience access to energy. So, and the energy poverty lens helps us to actually zoom in at the household level, because while everyone is working at the bigger scale, if we're not focusing on the household level, we have a high chance of leaving out poor people who are not able to access any of these renewable energy services that everyone is talking about. So this is why it's very important for my work. It's like, how do you make sure that the energy system is inclusive and everyone has the same benefit in this energy transition. And the way that I plan for it is in my work is really, we've just recently finished an energy use survey. So we worked to understand how are households accessing energy, what are the challenges at the household level, and try to understand the different energy sources they use so that we're able to see how we can intervene. But most importantly, we did this by using focus group discussions to get a much more detailed understanding of what the challenges are, because we might assume that it's easy to replace one energy source with the other, but not without understanding the social aspects of why people are still using polluting energy sources such as paraffin. And some of the issues that we're currently focusing on is access to public lighting. In South Africa, not everyone has access to public lighting, and with technologies such as solar, they enable municipalities not to spend a lot of money on infrastructure, grid infrastructure, because with solar, everything is integrated. You can simply put it in a community that is not even, you don't need a long term to plan for energy systems such as those. So I work on off-grid technologies, trying to see how can they meet energy sources, energy needs for communities. I'm also working on subsidy reforms, trying to look at how the municipality in Cape Town can reach universal energy access. So this would entail understanding who exactly is currently excluded from the energy subsidy programs. And one of the main challenges is that in South Africa, there's a huge focus on electrification, and yet we know that not everyone can afford electricity, and subsidies play a very big role in ensuring that people can access electricity, which is the cleanest form of energy at a household level, not from the big generation side, but at the household level, it's less polluting. Households can do more with electricity. Yeah, that's how I work.
Thank you. Thank you very much. The next question I have is, what is the best way to learn about sustainability and or who can advise you about it? But I'm thinking with this group, it's more like, how can you advise other people? You seem to be the senior leaders here. And so I'm going to turn the question around And I'm going to start, just to change the order a little bit, I'm going to start with Batul and see how you would advise or implement sustainability if somebody came to you and said they wanted to, put this into their program.
So basically, when thinking about sustainability, looking at the local context is very important. Understanding local context, local resources, and local needs. So the first thing is to really do the need assessment and resource assessment as well, to understanding the local context. So I would really suggest, and I also do that, is to look at, what are the challenges of the community or the setting of the country that we are working in, what are the resources available, what are the needs. So it's really important to understand the context as practical as it gets. And as far as the educational theoretical knowledge comes, our universities keep offering short courses and workshops on these topics. So I would really suggest if someone needs to dive into, a little bit of theory and educational background, to take some of the courses or the workshops. There are many good courses now available online as well, on the forums like Coursera, edX, Khan Academy, etc. One of the best thing which has helped me learn, which I also suggest my juniors, is to work with some senior mentor and to learn from them and their experiences. Also look at the past case studies. So from case studies, we learn what went well, what were the challenges, and how they, handled those challenges. So looking at past examples I will also very helpful, along with working with mentors, working with seniors. So they taking input from them really helps me also look at from the different dimensions and look deeper and really understand deeper things before really go and work on something. So yeah, these are the few things I would suggest.
Thank you. And I'm going to move on to Vendeka, I hope I'm pronouncing your name right, and ask you the same question. How do you advise others, and how would you recommend implementing, and how do you also learn as you further your experience?
Yes. So I think even just from this call, it's very clear that sustainability is very interlinked. So one of the ways that I work is that I collaborate a lot with people, because other people from other disciplines would see things differently. So I work with someone that understands buildings, who would help me in advising how to increase energy efficiency in a poor person's home. So it is a lot of, I'd say if you collaborate with a lot of people, others would bring their engineering skills to talk about what is the actual technology that can work in a particular context if you're working with the technology. But again, the local context is very important. Consulting with the people that you are trying to solve for, really doing that is the most important thing. Because, for example, if you're gonna think about putting a solar lamp in an informal settlement, that is actually very easy, because you can literally just dig a hole and do it. But the most important thing is making sure that people understand why it's there, and they can actually also adopt it as part of their lives. Because the other problem is that we can innovate as much as we can, but if people don't use the technologies that we ask them would think are good for them as well as the environment, then there's no need. It's not going to work. So I would say working with communities, if you're working with a particular community, consulting with them, educating with them, making sure that there's total buy-in. If they have concerns, take those concerns seriously and consult with other people in the field to understand how you can change the mindset, or you might need to change your design because it's not suited for the environment. Yeah, and I would also emphasize again that it's working with a lot of different teams, understanding how food works with energy, with mental health, with yeah, it's very interlinked, I would say. Yeah.
Thank you. And I would ask the same question of Oluchi, if you have some wisdom to share with us about your experiences with advising others and learning about sustainability.
I think for me, where I would begin is having sustainability as a worldview. So it's very important that even before you begin to venture into any program, any project, that at the back of your mind, you're thinking about what low environmental impacts is this going to have. And then aside environmental impacts, you're thinking about longevity. How do I ensure that if this is the correct program or project, that just like Fatma said, it outlives the funders if it is being funded. So I would begin with that worldview, that whenever we want to implement, we want to design, move forward with anything, that we begin with a low environmental impact worldview. I would also say that it also boils down to the design stage, because that is where you begin to talk about the indicators that you have to measure. That is where you begin to talk about what exactly are you measuring. That is where you set your monitoring and evaluation framework. And then if you have your sustainability indicators or your environmental indicators or whatever indicators you want to measure in terms of sustainability, it could even be any of the SDGs. If you have these indicators and targets at the very beginning, then it means that your work is actually already, just at the inception, it is already geared towards sustainability. So it's also about the design. But at CG, we're also doing this thing where mid-programs or annually, we now reflect. So it's not just about designing at the beginning of the program. It's about taking a pause, stepping back to see how exactly are these making the desired outputs? How are we achieving it? How are we not achieving it? What are the risks that we've managed to mitigate? What are the ones that have persisted? What are the negative, untalked previously of impacts that we're having that we could now sit back to revise or reflect on? But just as Tandeka has said, it's thing about partnership that we also do a lot. So nothing is actually going to be sustainable if you work alone. So it's not just multidisciplinary partnership as researchers or as implementers. For us, it goes further ahead, is multidisciplinary partnership with government, is multidisciplinary partnership with NGOs, with international NGOs, with various, because everybody has a role to play at this table, and every partner's role is way different. And each added partner that brings something positive to the table makes whatever program or project more sustainable than if it was without that said partner. So it's about building lasting partnerships that will get us to where we want, be it sustainable environment, be it sustainable health system, be it sustainable food system. It's about what are the essential partnerships that can drive that sustainability. Yeah.
Thank you. It's like weaving a very strong net so that everything holds together. The next question I have, I'm going to put together as two questions. What are the challenges you face with sustainability, and how have you overcome them? And some of the challenges I suggest are, resources, including finance and human resources, How does geography and location affect sustainability? How does uncertain transportation? How do you maintain staffing committed to sustainability? Do government regulations help or impede sustainability? Do cost factors impede implementing sustainability? And how do illegal activities such as illegal mining affect your efforts to sustainability? You don't have to answer all these questions, but I just threw those out as some of the possible challenges that you might be facing in some of your program work. And if you want to pick one or two of these, or none, if you don't really have any challenges, that would be fantastic. So I'm going to start with I'm sorry, Thandeka again, and then we'll pass on to Batul and then to Oluchi. Thank you.
Yes. So from my side, so I work for the government. So as we all know, government processes take long. So that would be one of the main challenges, is that it doesn't matter how great the program is, you just have to be paid that it will take long because it has to go through a lot of various decision-making processes. I would say that is one of the biggest challenges, but I think the biggest one is financing. We're talking about the work that I do really targets low-income households, and I work for a city government, and it's all about balancing, service delivery and nice to have programs such as the sustainable programs. Sometimes they're seen as nice to have when people really need their trash picked up, they need water, and so it can be a bit challenging from that perspective. So and some of the way that I've tried to overcome some of these challenges is really partnering. I work with a lot of multinational NGOs that bring technical assistance, and because most of them are funded externally, it's easier to collaborate, and once you have evidence to actually support your work, it's much more easier. So I'd say so a lot of the challenges that I face has always been just about working with a lot of people from different aspects of life, at different NGOs, different types of partners. And I think the other challenge I would say that I also face is the fact that I work with low-income households in informal settlements, and we know in South Africa they do tend to grab pieces of land and they settle on pieces of land that are prone to flooding, and it's very challenging to try and build the balance between providing sustainable projects to such households, and yet they also seem to put themselves in those types of situations where they build their houses on wetlands, and so I'd say one of those like big challenges that I face in my work.
And am I unmuted? Yes, okay. I'm going to ask the same question of Batul and find out how some of these challenges might affect the work that you do.
Yeah, I wish there were no challenges, as you said, but life of development professionals, public health professionals is full of challenges, especially when it comes to mental health. Like other areas, we also face tons of challenges. First and foremost, definitely financial challenges, because usually for a lot of government, especially lower and middle countries like Pakistan, mental health is never a priority. Because we have so many other infectious and maternal and child health issues, still so much maternal mortality is high, child mortality and malnutrition is so high that mental health, though, seem to be very clearly affecting maternal and child health, still does not come to the radar of policymakers and government officials. So there is, when it comes to resource allocation, mental health does not get its fair share. So starting from there, the second huge challenge that we face is definitely human resources. So Pakistan is the fifth most populous country in the world. And for such a huge country, we have less than 500 psychiatrists and less than 500 practicing clinical psychologists. So for such a huge population, when we don't have enough mental health care providers, and out of these mental health care providers also based in, the major cities only. So when we talk about geographies, when we go to, small cities and other areas, it's really sad to see that there is no mental health professional over there. And there are a list of challenges, but for these challenges, what we are doing is that we've been working on the approach of task sharing, which is basically the approach in which we train community health workers, peer workers, and available resources in the community for basic counseling and identification. So we have been actively working with our Lady Health Workers program, which is one of our major programs, which was initially initiated for maternal and child health. So we have trained lady health workers who are working on those areas to, identify mental health issues in women and children and communities, and do the basic counseling, provide basic support services and referral where needed. So that is the one thing that we are doing, is actively doing task sharing and, training more and more healthcare providers. So previously there was our nursing, another allied healthcare staff was also not trained in mental health. So what we are doing is that we are actively, trying to train health nurses and other allied healthcare workers as well, and primary healthcare providers as well, who are not usually trained in mental health. So we are trying to include mental health into the curriculum of, lady health workers and nurses, so that, the access can be increased, so that the basic health problems can be tackled at those levels, and there is a less need to reach to the, higher level psychiatrist or psychiatrist only for the higher cases. Plus, what we are also doing is, developing telehealth services. So into far, difficult to reach areas where, there are no mental health care providers, but technology nowadays is such a helpful tool that is available. People have a smartphone even in the rural areas. So connecting some healthcare provider in this area with mental health care provider in large cities like Karachi, the psychiatrist in Aga Khan Hospital. So there is connection. So when there are complicated cases or where the support consultation is needed, so either the healthcare provider can take the guidance from the healthcare provider, or connect the patient to the directly, talk to the psychiatrist or psychologist. Plus, as I mentioned, that I develop psychosocial interventions, community-based psychosocial interventions. So, for example, in one of the trial, what we did that in the slum area of Karachi, which is kind of a village. In some places, there was not even the electricity available. What we did is that, again, training lady health care workers, but also developing group of women. So, and training them, to come together, talk about their life challenges, and with the minimal help of lady healthcare workers, we were able to show that that group intervention not only helped the depression and postpartum depression in women, but it also helped improve the early child development indicators, child development of their children. So these kind of interventions trials and doing with my colleagues, and we are trying to scale up those things so that it can become more sustainable. Another challenge that we face is a stigma. I'm sorry, am I taking too much time? I can't hear you. I think you're muted.
Okay. Your answer is really very eloquent and very interesting. We're coming close to the time where we want to open up the talk to the rest of the audience, and we haven't heard from Oluchi yet. So I was hoping we could hear from her, and then we could open up the talk to other to the audience, because I know there are several people in the audience who work in sustainability, and I'm sure they have lots of questions for you. So I hope this isn't too much of an interruption for you, because it was very, very interesting what you had to say. But time, unfortunately, is not our friend here. So I'd like to move on to Aluchi, please, for your answer.
My challenge is very short, and that is global financing. And I'm speaking of global financing from money that is there for environmental and climate change. So a recent report by FAO looked at the Climate Policy Initiative, and it found out that only 4% of the global climate finance money went to agri-food systems between 2019 and 2020. And 4% is just too small. Every other money goes to other things. But then there is actually nothing that is quite as tangible and quite affects huge number of population than agri-food systems, especially in low and medium income countries where it is much needed. So, and I do not have personal solutions to it, but I just know that we need to create financing systems that would at least drive climate finance funds to agri-food systems. Short and simple.
Thank you. It's not simple at all. The words might be simple, but the cause is far from simple.
Exactly. If it was simple, it would have been done, but yeah, we know it's not simple.
Right. Madeline, I'm going to turn the meeting back over to you to recognize the grantees in our audience and others who are working in sustainability, and to thank again our grantees who have taken time from their work and their families and friends and busy schedules to be with us this afternoon and provide us with so much information and so much commitment to such an important cause. Thanks. Madeline, it's your turn now.
Thank you, Priscilla, and thank you for asking all those very important questions. And I think we got the answers that we wanted to know even more. I've noticed Lillian Elekwachi, Ridi Elshah, Ruth First Ayonde, Ajat Jimon, Lillian, I did say Lillian, Nubia Castiblanco, Nosifo, and Rose Barr. And please forgive me if I didn't recognize you with your names, but it's wonderful. They are all grantees from the past, and they always stay our grantees from different years. I saw that Lillian raised her hand. You had a question.
Sorry,
Lillian?
I didn't realize that I was trying to turn on my video. Can you hear me?
Oh, so you just waved. Hi.
I
You
did.
can try your...
Sorry, I didn't know.
Okay, in the meantime, while you get your video on, I'm going to ask Ridi. Ridi, definitely you should know about informal settlements and getting affordable housing and whatever you would like to share with us. Please, Ridi, our architect grantee.
Thank you, Madeline. Inspiring work. Like, just amazing to see that in the limited resources you'll have in those countries and at the place at which you're working. Because I'm working on affordable housing in USA, and even though USA has a lot of resources, we are struggling to get clean energy for low-income housing in USA itself. So to have the courage to do this, to solve this problem in Pakistan and Africa, that's amazing. So kudos to all three of you. And I think one question that I have for you all is that how do you make a case for clean energy when your beneficiaries are already facing these problems related to water, housing, and even food, right? So those are the basic requirements. And clean energy, in a way, is like the last thing on their mind, and even for the government. So in that scenario, how do you make a case? And like we all understand, right? Like this is all circular. It all comes together to say that it's sustainable. But for our beneficiaries, for our government agencies, this all work in silo. And the main problem over there is how do you start making them work together to solve this problem versus thinking that we will first solve housing and then we can solve sustainability. That's not the way it works. It has to go hand in hand.
Thank you, Ridi. Tadeka, are you going to answer first?
Yes. So I would say from our side, a lot of the work that we've done so far is just research. And our department is still new at the City of Cape Town. It's started in 2017. So a lot of work for now is just like making sure that we have enough research, but also segmenting the population in such a way that we understand the challenges that each of the different customers have. So for example, people in informal settlements, what are the main challenges that they face? We also have what we call backyarders, understanding what are the challenges when it comes to energy access and what are the interactions between the landlord and the tenant. And I would say that doing an energy use survey was actually the most insightful thing, because suddenly you can see that so in one of the questionnaires we asked people, do you have access to a refrigerator? Because it's very important to understand how they store food, and so that they have nutritious meal in their homes. And a lot of the people said they don't have access to refrigeration, and that tells you how much they spend on just buying food so that it just lasts them for that day. And a lot of people also responded that on the mental effects that not having a constant supply of energy has on them. So one of the respondents said, I constantly have to think about my son is coming back from school. What am I going to cook? With what? And it's just like a lot of pressure. So I think once you have that type of baseline and very clear results that are coming from people that you've interviewed on the ground, it's easier for people to really see the interlinkage and understand that clean energy is not something that should be put at the back end. It's something that really intersects with a lot of other issues in the city, and it's very important. Issues around housing, for example, it was very clear from our survey that if you live in an informal settlement, heating is one of the big challenges because of those zinc. The metal sheets that people use are not insulated. That means that when it's hot, they're really, really warm inside. When it's cold, it's really, really cold. So that affects their health as people. So this speaks to a much wider system. And then from that perspective, then we start talking to our health department and say, hey, here's what we experience. Can we start thinking of this from a systematic approach? How do we deal with housing, and how do we deal with all the other things that are related to energy?
Right. I think this is a lovely answer. Do any of you want to add to that, or shall we go to a next question, seeing that we are limited for time? I saw Rose Bar. You raised your hand. Could you pose your question, please?
Yes.
Comment or even help, because remember, we can all learn from one another. So if you could guide them or give them tips, it's great.
Yeah, that's a lovely section. So my question is actually to Fatima. Fatima was coming to say something about the challenges that she's been facing and mentioned stigma. There is a nice work you are doing there. Why stigma? Maybe you could just explain a little bit. Yeah.
So basically, there is a huge stigma around mental illness, and that is not just in Pakistan, but also world over, because mental illness is usually considered a personal weakness and not really an illness. So when someone has any mental illness, people are considered weak or something, that they have done wrong, or they are not, when they are depressed, they're considered that they are not thankful enough, they are not looking at the positive side of things. So they are constantly asked, just think about positive things, just look at positive things, rather than realizing or supporting that, it is as much of an illness as any other physical illness. We don't, disregard or discourage if someone's bone is broken. We don't ask them to, just kind of ignore it and, take it with a pinch of salt or anything. But when it comes to mental illness, either it's personal weakness, that a person could not handle the situation, the person, it's the personality issue. So something which comes around to the blaming the victim kind of thing, and also it's kind of considered shameful. So a lot of people, that's why, are reluctant to share if someone has mental illness as compared to any other illness. So if someone has diabetes or cancer, that person would say or share it with everyone, and everyone would empathize. But when people have mental illness, they usually try to hide their diagnosis, because one, they are facing the challenge of dealing with the diagnosis itself, the symptoms of depression, anxiety, or whatever it may be. Plus the way people treat it, as if it's nothing. You are kind of making a thing out of it. So when I did studies, also a lot of women, they were coming for treatment without even telling their family members. And in my clinical practice, males also, when they, if they could, they would not even tell their family members they were coming to access the services, because even the family members, they would not accept it or understand it or support it. So forget about the community. A lot of women fear divorce, and there have been cases in which women were divorced for saying that they are lunatic or something, the kind of memes or the terms that are used around it. So unfortunately, understanding and awareness about mental illness is very low in not just in Pakistan, but world over. There is a lot of stigma around mental illness, and that's why people tend to hide it. People don't share with it, and that's what we are trying to do, is to help people understand that it's just an illness, and anyone can have mental illness at any point in life. There is nothing wrong about it, and it's manageable and treatable. In interest of time, I'll keep it that here.
Thank you, Batu. I think mental illness is going to rise, and which is very sad for our 2030 goals with all the wars. Could you imagine the mental health issues there, and just trying to find food? So mental health is a very important factor on that. And thank you for your question, Rose. I see there are even more of our grantees here. I think I've got Fatima here, and I have Milka. Time is running away with us, as Priscilla mentioned, and we should respect your time as well. Is there a specific question you would love, or a comment you would like to make? Just raise your hand quickly now, and then I'll choose and I'll get to you. What I can tell you is that we will have this video ready, I would say within a week. Yeta, is that too soon, or Martha? But I think within a week, we would have it up on our website. If you joined a bit later, you can actually follow what everybody said there. And for our grantees, we are so proud of you, and know that you are contributing to sustainable goals that we all need. And it is just so heartwarming to know that we have so many people being part of this, dreaming big and going for the goal to get there. Thank you all for being here, and we will see you soon, because MEG Talks will not disappear. Thank you very much. Goodbye.
Thank you so much. Thank you.
Bye.